Hello, I'm Dr. Craig Morton. Today I'm going to discuss a condition known as pelvic crossed syndrome. This is one of the most common conditions I see in my medical practice and one of the key issues targeted with the Rehab Zone home exercise program. But before we can get started, let's learn a little bit about the anatomy of the low back. In the lumbar spine, we have 5 vertebrae, or backbones. 1, 2, 3, 4, 5. Between each vertebrae is a disc known as the intervertebral disc. This provides a cushion to the spine, sort of like a shock absorber. In the back of the spine, we have the joints. There's 2 joints per level. This allows the spine to articulate, to flex, to extend, and to rotate. Whenever we have a bad disc, a bulging disc, a herniated disc, it hurts to flex forward. When we bend forward, we place excessive pressure on the discs, and this results in pain. Whenever we extend the back, if we have arthritic joints, that causes pain. So extending and flexing can both cause pain depending on what part of the spine is involved. Pelvic cross syndrome involves the muscles that support this spinal column. There's abdominal muscles in front, back muscles, you have the hip gluteal muscles, and you have the hip flexor muscles. Due to today's lifestyle, we sit down a lot. We're not as active as we could be, and over time, there's consequences. We get weak abdominal muscles, we get weak gluteal muscles. Our upper back muscles get very tight and stiff, and our hip flexor muscles get tight and stiff. What this results in is an abnormal posture of the spine, causing excessive extension because of the tight back muscles and the weak abs and the tight hips. This results in a lot of pain throughout the joints. Whenever we're trying to correct pelvic cross syndrome, we want to reverse this. We want to strengthen the abdominal muscles, strengthen the gluteal muscles, stretch the hip flexors, and stretch the back muscles. What this does is take the spine from excessive extension back to a neutral posture, therefore relieving pressure on the joints and hopefully relieving pain. One of the consequences of pelvic cross syndrome is how much stress it places on the hamstrings. The hamstrings are what connect our legs to our hips, and having tight hamstrings can ultimately place more pressure on the discs. I'm going to bring Carl in to help demonstrate how having tight hamstrings can actually place more pressure on your discs. Whenever our hamstrings are tight, if we go to pick up an object and bend forward, you can see that the pelvis stops right there because the hamstrings are very tight. As Carl bends forward to pick up the object, he's having to flex his spine excessively to get to the ground. This places a lot of pressure on the discs, which will result in pain. Now we're going to return back to our standing position. With flexible hamstrings, Carl is able to bend at the waist, but they're not being held back anymore. He can get almost to the bottom before he actually has to bend. You can see there's barely any flexion in the spine because his hamstrings have allowed his pelvis to rotate. And we'll return to a standing position. That summarizes the condition known as pelvic cross syndrome. I hope you enjoyed this educational video. If this sounds way too familiar to you, start your rehab program today and begin living life to the fullest.